Good afternoon. As you've already heard, one of our residents who has been hospitalized since last Sunday was diagnosed last evening with COVID-19. What I can tell you about the resident is that the resident returned from Westminster Canterbury Richmond from Florida early last week. Thankfully, the contacts were limited with other residents. And was sent to the hospital for symptoms which were not the standard symptom set for COVID-19, which would normally be symptoms of fever, cough, shortness of breath. Our resident went out for other symptoms, but was tested at VCU Medical Center and tested positive last evening. The epidemiologists are working to trace all of the resident and his wife's contacts and let them know they need to be in self-quarantine for 14 days from the date of exposure. Thankfully, some of these potential exposures are a week past as of today. Dr. Danny Avula and the epidemiologist team from the Virginia Department of Health have been on our campus most of the day, and some of their staff will be here every day for the foreseeable future. They truly have been fabulous partners for me, Gail Hagland, communications team, and the clinical teams in Parsons Health Center, assisted living, and in the clinic. With Dr. Avula's help and encouragement, we made the decision today to write and send a press release and subsequently hold a press conference at 1 p.m. this afternoon outside our gates. Some of you may have seen that on the news. The press release is available on all of the methods we normally communicate with you. Now I know some of you wanted me to communicate those details to you prior to hearing it on the news, and I understand that sentiment completely. However, I made the decision to get out in front of the media before they started coming after us for information. I wanted to let Dr. Avula speak to them and to you. Then now, I can begin to work with you on the next steps of getting our community back up and running again. We all know that this is a trying and concerning time. Let's be honest, this is a national health emergency like none we have seen in my lifetime. And Westminster Canterbury finds itself on the front lines. I want you to know these things. Any and all staff who have had contact with the affected resident are now at home in self-quarantine. All residents with any known contact with the resident have been identified and have been or will be interviewed by the Virginia Department of Health, and they will be given further direction relative to quarantine. I need to insist that you stay in your apartments until VDH gives us further instructions as to who is in quarantine and who isn't. We are expecting that to occur this afternoon, but I do need to prepare you that it could be tomorrow morning. We really have no control over their process. As I've already said, VDH staff will be here again in the morning to meet with our incident command team and continue to work with us to contain this situation. If you're having trouble preparing your own meals, please call the promenade. If you can prepare your own meals, please do so, as it will really help us with the burden of getting meals to everyone tonight and tomorrow morning. Our ongoing communications are posted on our website, our Touchdown Community app, and increasingly we'll be doing it here on TV 970. Please check these sources, as we will only deliver information to your door when it's necessary, when we really need you to know something like we did last night. Our intent is to begin to bring this campus' core functions back up as the restrictions get lifted. But we will operate under the governor's call for no more than groups of 10, and the governor is recommending that seniors over the age of 65 self-isolate. So we're going to work to bring up programming and services that are consistent with the governor's directive. As you would expect, programs and services will be changing in their form, such as we'll focus on takeout dining, perhaps room service dining. Got to work with the team, and that will take some time to bring up. We'll provide access to recreation staff and supplies. Pastoral care and fitness programming will likely move to TV 970 or 971 in the near future. Our incident command team will be meeting at 9 a.m. tomorrow, and I would like to speak to you again here on 971 after that meeting at 10 a.m. So please join us again on TV 970 at 10 a.m. tomorrow. I'll know more about the future programming after that. As you know, and we expected, we're getting a lot of phone calls with questions, and a lot is probably an understatement. I'm just going to go through probably the top 4 or 5 key questions, and we'll continue to try to answer these questions and document them and get them to you in written form, most likely tomorrow sometime. The first is dog walking. This was an issue from the very first minute of this morning when people woke up and needed to take their dogs out. The answer to whether you can take your dog out for a walk is yes. I mean, we need to take care of our animals. But we would ask that you maintain distance from anyone you might encounter, and please return immediately to your home or apartment. This is really for your health and best interest. Meals, if you need dinner tonight, please call the Promenade line and we'll get a meal to you. If you can cook for yourselves, please do that. And if you need anything from a grocery standpoint, please reach out to the Promenade line and we'll work to get you what you need. If you don't feel well, please call the clinic. That number is 6231. The clinic is a very busy place, so if this isn't fever, cough, congestion, or really not feeling well, if it can wait, I guess. If it's not emergent or urgent, if it could wait, it would be good, because the clinic is a very busy place today, and it will probably be tomorrow. The other question that we're being asked is, what if I want to get tested for COVID-19? We should know tomorrow about getting access to testing kits from the Virginia Department of Health. Now, these tests, because they're not going to be administered by those that were exposed, or for those that were exposed, they're going to go out to a third-party lab, and it's going to take a good number of days to get them back. For those that were exposed, the Virginia Department of Health will process those tests and we'll get them back quickly. But if you want to get tested, let us know tomorrow through the clinic and we'll create a list, and when we have those tests, we'll begin to administer those. And lastly, how can I get more information? Well, as you know and would expect, staff are swamped right now. But if your need for information is urgent, I ask that you call your social worker, and they will call you back. I'm not exaggerating when I tell you they've been on the phone since they got here this morning without stop. So please be patient. If your information is more general, or you want to provide information to your loved ones, which I encourage you to do, please share our ongoing communications through our website, www.wcrichmond.org, the Touchdown Communities app, and TV 970. Again, I want to thank everybody for their patience, for your kind words, for the support of each other, and please pray for our resident. Thank you all very much.